welcome to Viewbox by Radiance Diagnostics. Today's episode is extremely important and highly requested. We are going to talk about epilepsy. We shall break down epilepsy from basics to breakthroughs. What causes it? What triggers a seizure? What modern treatments are available? First aid, myths, and how people suffering from epilepsy can live full and confident lives. Doctor, welcome to the show.
Thank you for calling me for this show. This topic is very close to my heart, and I think it requires people to know about this topic in detail. So I thank you for calling me for this show.
I agree with that. So before we dive into diagnosis, treatment, and lifestyle changes, let's start with the basics. What is epilepsy?
So first we'll tell you about seizures. So seizure is when there is excessive brain activity. So your brain is more like a network of wires. Like there is electrical circuits. The brain also has got its own circuitry. So they have to fire at a particular rate in a particular fashion. So when those electrical activity fire in an ill-sustained way, and there is continuous activity in the brain, that causes excessive movements of your muscles, and that causes seizures. So there are many types of seizures. So some are the common types which we see in movies, where they say there is both hands, legs are shaking, which we call it as a generalized epilepsy, in which there is both posturing, what we call as both hands, both legs will get fully tight, person will have frothing from the mouth, there will be facial twitching and loss of consciousness. So that is called as a generalized seizures. So that is what is people know most of the time. And the second is what we call as a complex partial seizures or focal seizures. So focal is when the seizure activity starts only from one part of the brain. So generalized means when both the brain activities fire together. But when the seizure focus is only one part of the brain, then people got what we call it focal epilepsy. In that area, only one hand or leg may shake, or sometimes the person may not even shake. They may have only confusion for a while. They may talk irrelevantly, or they may have certain purposeless movement, like what I would say automatism, what we call is. So epilepsy, so seizures are not just what we see in movies where there is violent movement. There are many types of seizures.
So is every seizure equal to epilepsy, or are they different terms?
So seizure is a mechanism. So epilepsy, there is a definition. There is an International League Against Epilepsy which has defined epilepsy. So if there is more than 2 episodes of seizure, or there is 60% more likelihood that a person may get a second seizure, or there is a genetic risk for seizures, then we'll call it a epilepsy. So there are 2 separate terms.
What are the most common causes of epilepsy among Indian adults?
So there are 2 different kinds. So one what we call is a genetic epilepsy. So genetic is when you got a positive family history, or sometimes there may be certain genes in your body. It may come without also family history, and that genetic predisposition is there which causes you to get epilepsy. So first is called as a genetic epilepsy, where your MRI, everything will be normal. Second is called as the acquired causes of epilepsy. Acquired causes include metabolic, like a simple cause like would be when the sugar goes down, or if your sodium goes down, that is called as the metabolic cause of epilepsy. Other causes are toxins, certain toxins, alcohol, those things also can trigger epilepsy. Anything which affects your brain, like if there is an infection in your brain, what we call as encephalitis or meningitis, or if there is a tumor in your brain, or if there is a small infection or anything structural in your brain. So anything which is there in your brain, it could be infectious, any toxic, any metabolic, any trauma, if you have got a head injury, all those things are the causes of epilepsy.
Can stress, lack of sleep, or increased mobile usage trigger seizures?
So all those things are what we call as the risk factors for triggers of epilepsy. So by itself they won't cause any seizures, but studies have shown, and we see in our daily practice, lack of sleep is one of the most common cause of epilepsy, of seizures. So a person with seizure should have adequate sleep. Second thing, excessive use of mobiles and screen exposure can be a trigger for seizures, especially if there is a flickering, if high video games. So video games, if there are very sharp color contrast, so lots of color contrast, that can be a trigger for, in certain epilepsy, that could be a trigger. Stress is also another trigger for epilepsy.
Is epilepsy a lifelong condition, or can it be fully cured in some individuals?
So there are, as I told you, epilepsy is just a disease, it's a syndrome complex. Epilepsy has got various causes. So if there is something, if it is a acquired epilepsy, now if there is a infection, then if you treat the infection, the seizures will go. if there is a small what we call, if it is because of sugars, low sugar, or if it is because low sodium, you treat that condition, it will go away. So the treatment of epilepsy, whether it will get cured or not, it depends upon what is the cause of epilepsy. So if it's an acquired cause like an infection or a tumor, you see, or if it is a what we call a metabolic, so you correct those factors, the patient may become seizure free for life. But if it is a genetic epilepsy or what we call idiopathic general epilepsy, those may not get cured, but with newer medication they may have excellent control.
Now that we have spoken about the basics, let's go into the diagnostic part of it. So doctor, what is an EEG and what does it reveal?
So epilepsy diagnosis requires few things. One is a clinical. So you should see for the clinical signs and symptoms of epilepsy, of the seizures, I would say not. Second, so when a person, if we suspect a seizure, second step what we would take apart from the blood test would be something like EEG. EEG is electroencephalogram. So in that we connect wires to your brain on your skull. So that will detect, so what is epilepsy, as I told you, seizure is just abnormal electrical activity in your brain. So the EEG monitors the electrical patterns in your brain. So the brain neurons are continuously firing electrical impulses. So there is a particular pattern which is normally there. So if that pattern is not there, that will be detected in your EEG. So when wires are connected to your brain, the machine will see what is your brain waves. So there are various brain waves which we see depending upon patients, whether it is sleeping, awake, and that will detect your seizure activity in your brain.
Alright.
So EEG is the most important investigation when it comes to diagnosing epilepsy. But normal EEG doesn't rule out seizures, but abnormal EEG proves seizures.
Alright. You have made a mention of blood tests. So which blood tests are done for such patients?
So routine, so it all depends from person to person. So so when you see the patient, you decide what kind of epilepsy it fits into. So blood test would include simple counts. It would be biochemistry like sugars, because I don't have low sugar, I'd say, or even very high sugars in diabetes that can trigger seizures. Electrolyte imbalance, a simple low sodium can trigger seizures, or even low calcium, very low calcium, that can trigger seizures. So metabolic profile, what we call it. Other would be to look for any systemic infection in a person, or if there are certain antibodies, something we call as autoimmune epilepsy. In those, so it is tailor-made for the person. Okay. So there is not one investigation which would give an answer. So it depends upon what you find on the examination.
In which cases does MRI help to find the source of seizures?
So MRI is an important tool. So MRI we use in cases of acquired epilepsy. So if our EEG shows that it is a generalized seizure, so if the EEG shows that the seizure is coming from both sides of the brain, that means it's most likely a genetic epilepsy or a metabolic. In those cases, MRI may not be of that importance, but if it is a focal seizure, if your seizure is coming from one side of your brain, then MRI is the most important tool because it will help us to find the cause. So MRI is a better tool than CT because MRI gives us a very good insight into the structure of the brain. So CT scan is mainly for certain conditions, but MRI gives us a good structural mapping of the brain. It will show us if there is any tumor, if it will get any scar in your brain. So it helps us in finding the cause of the epilepsy. So sometimes there may be a structural, from birth there may be certain abnormal tissue in your brain which will be picked up on MRI. So in cases of focal seizure, focal epilepsies or acquired epilepsy, then MRI is a must to find out the cause of epilepsy.
So people come across this term called MRI Epilepsy Protocol. Can you simplify it?
Yeah, so that's why it is important to, because when we do a MRI for epilepsy, the protocol is different. So when we want to see, so if the EEG, as I told you, is the first step towards diagnosis of seizures. So if the EEG is showing that your seizure is coming from particular area, maybe a temporal lobe, then the radiologist will take particular sections. So there are certain sequences when you take an MRI. So what do people do is they just, when they go for, they get something abnormal, they get a seizure, they will directly get scanned themselves. Now what happens in that case is you will not miss out certain small structural changes which will be picked up only in detailed sequencing. So when we do a epilepsy protocol, we take thin oblique hippocampal cuts. So hippocampus is the area which is commonly associated with seizures. So those thin sections will be taken at that level. If you don't take that sections, you may miss out on certain changes in that area which will be missed on routine scan. So routine MRI may miss those what we get hippocampal sclerosis, we call it, when the changes in the hippocampus which will be missed, and you will say the MRI is normal when the MRI is actually will be abnormal if you do those sequences. So epilepsy protocol is absolutely required when it comes to a patient with seizures.
Doctor, for difficult to diagnose cases, doctors talk about brain mapping and volumetric studies. So what are those exactly?
So volumetric studies, so if we are suspecting something called as the temporal lobe epilepsy. So temporal lobe epilepsy is a kind of focal epilepsy, means the seizure is coming from one area of your brain. And so based on the seizure type, based on the what the patient tells you, what kind of seizure is having, whether he's having facial twitching or he's having confusion or whether he's having this involuntary movements, we can fairly localize from where the seizure is coming, because the brain has multiple lobes. There is frontal lobe, there is temporal, parietal, occipital. So each lobe seizure will have a different seizure type. So frontal lobe, if it is a frontal, means the front part, those seizures will be different from a seizure originating from a occipital lobe, which is from the back part of your brain. So based on the seizure type, we are able to roughly know from which area that seizure is coming from. Now in certain epilepsy is called as a temporal lobe epilepsy, when the seizure is coming from what we call as the temporal lobe. So sometime what we see is the area called as hippocampus, as I told you. So hippocampus is the area which is concerned with memory, and that is one of the commonest area affected in temporal lobe epilepsy. So volumetric studies help us in noting whether both the hippocampus are equal, the volume is equal in that area. Any change in volumetry, if significant difference, may point that hippocampus is an abnormal area, if there is an abnormality in hippocampus, which may be a cause of seizures. So volumetric analysis we advise in patients who are suspected to be a temporal lobe epilepsy.
If suppose a patient runs through all these tests and they turn out normal, are they still more likely to have epilepsy?
There is not likely to have epilepsy. MRI can be normal. There is, in most of the cases, they may be normal. So normal MRI doesn't say that there is no epilepsy. Epilepsy is when you see a clinical history and EEG. If your EEG is abnormal, there is definitely seizures. So it all depends what the patient has come with. So everything may be normal, still the patient may be still having seizures, and it may be something called as a generalized epilepsy. So general epilepsy, it is mainly at the level of the microscopic, the cellular level, and the cellular level you cannot make out on MRI or anything. So person may still have seizures and every investigation may be still normal.
Doctor, let's talk about triggers and precautions. So what are the most common everyday triggers people should be aware of?
Most common trigger that I told you is the sleep deprivation. So your brain has got something called as circadian rhythm, where when the sun sets, certain hormones are released which will trigger you to go into sleep. And then when your sun rises, then you have got certain hormones which will trigger a awakening state. Now what nowadays, because of too much use of mobiles and all, people are sleeping late. So that circadian rhythm is broken. So that can be a trigger for seizures. So you have to sleep well. So 6 to 8 hours of sleep should be there in any epileptic patient. If there is no proper sleep, if there is sleep deprivation, then irrespective of the medication, the risk of seizures will be very high. That's why when we do EEG, sometimes we'll tell somebody to do a sleep deprived EEG. Sleep deprived, we tell them to sleep less and we do a EEG, because the epileptic activity significantly increases when a person is not sleeping. So sleep is the most common triggers. Other triggers would be, as I told you, video games, or what we call as photosensitive epilepsy. So certain seizures can be triggered when they see color contrast. So like disco lights. So disco lights may be a trigger in some, or black and white lights, if the TV is flickering, if there is some flickering in TV, or if the patient is playing video games, that can sometimes triggers. So in those patients who are photosensitive, we should avoid those particular triggers. Overuse of mobile and electronic gadgets should be avoided. And other thing would be avoidance of alcohol or any addictions. So that also is a trigger for seizures. Other than that, certain medications sometimes can reduce your seizure threshold. So person who is having epilepsy should inform any doctor so that they avoid those medications.
What is the correct first aid to be given to a patient who is going through a seizure, and what should people avoid in that situation?
So when person is getting seizures, first thing you should see is you should give him a lateral position. You should turn, if he has fallen down, you should clear all the area so that he doesn't hit anything. So area should be cleared so the person is safe. You turn him to one side because there may be vomiting, there can be secretions. So seizure, if it is a short seizure, it won't cause any damage to your brain or it won't cause any issues. But if somebody gets too much of, if he gets vomiting or if there is lots of saliva, that may trickle down your airway and it can cause you to have a pneumonia, and that can be dangerous. So when somebody gets seizures, you have to just make sure he is safe, turn him to one side. Okay, don't try to hold him too much or don't try to put hand in his mouth, because you will get injuries. You will get a bite, you may get injuries. Instead of saving him, you may get injured. Don't try to put any metal in his mouth or anything in the mouth, because it may cause injuries to the person. So turn him to one side, wait for the seizure to stop, and if the seizure is not stopping within few minutes, then you have to immediately call ambulance. Nowadays we also have the sprays which we can give to terminate the seizures. So those things the doctor will prescribe, and you can use that spray to immediately stop the seizures.
Can epilepsy affect driving, swimming, or working at heights?
So patient with seizures, we tell them to avoid driving, mainly for his safety and the person who is on the road, his safety, because seizure is something which is unpredictable. Despite whatever you give, there is always a risk that somebody may get seizures. And while driving, if you get seizures, then you will put your life and the other person's life at risk. So a particular duration based on where the person is. In different countries there are different guidelines where the person can drive. So ideally a person with seizure shouldn't drive for a particular period till he is seizure free for a certain period of time. So once he is seizure free on medication for a particular period of time, then he can drive. Swimming alone shouldn't be done, because if you're alone and if you got a seizure during swimming, you may drown. So patient can swim, but there should be somebody around who is there to monitor him and can help him in case he gets seizures. So that aided swimming unassisted shouldn't be there. There should be somebody who is there around to take care. Heights should be avoided for the person's safety. If he gets seizure, he shouldn't fall down. So heavy machinery, heights, or work near fireplaces. So any activities which may endanger him during the seizure, those should be avoided.
Okay. How important is medication and adherence to it, and why does missed doses cause breakthrough seizures?
So nowadays with modern medicines, so epilepsy can be almost controlled, and even you may get seizure free with medications very well. And the safety profile of current medications is very good. It is quite safe. So the adherence is important, because when you give certain tablets, they have to maintain certain blood levels of the medication in your body. So that much level of the drug has to be in your body to control the seizures. So if you break this, if you don't take medication regularly, if your compliance is not good, then that level of the drug in your blood will come down. That can be those seizures which are suppressed, they will get activated. And if you don't have seizures, generally what we consider is a 3 year of seizure free period. If you don't have seizures for 3 years, then we decide upon whether to continue the anti-epileptic or not. So seizure medication adherence is most important, because if you miss, the risk of recurrent seizures will be very high. So nowadays with modern medication, seizures can be controlled in almost most of the patients.
Now we shall go forward with treatment. How effective are modern anti-epileptic medications today?
So over last even 20-30 years, the seizure medications have improved drastically. Initially around, even if you got 1980s, there were 1 or 2 medication. Now there are lots of medication. So each new medications are more safer than the older generations. So there are the newer generation anti-epileptics, what you call. Most of them are extremely safe. So it can be, there are medications which we give even in pregnancy, and those medications, all the medications are tested very rigorously. So medications, almost 70% of patients won't require a second anti-epileptic drug. They will get controlled only on single medication. So most of the medication now are highly effective. Only the medication has to be tailor-made. So seizures, it's not a blanket drug. You give any drug and it will get control. It depends. So seizure medication is tailor-made for the kind of epilepsy. So focal seizures will have different one. Generalized will have different one. If it is a child, we give different seizure medication. If it is a female, we give different medication. So medication has to be tailor-made. So if the medications are not proper, then the seizure may not get a control. So it is optimized medication based on the type of seizure and the patient demographics.
Yeah, what is epilepsy surgery and how common is it?
So epilepsy surgery is when we do surgeries mainly for drug-resistant epilepsy. So what is drug-resistant epilepsy? So drug-resistant forms only around 20 to 30% of all epilepsy patients. So those are patients who don't respond to 2 or more anti-seizure medication in an optimal dose. So those patients who are requiring more than 2 medication and continue to have seizures, those are patients which called as drug refractory epilepsy. So there are many causes for drug refractory epilepsy. One simple thing is non-compliance. Patient may not be taking medication regularly. That is the most common cause. Other thing, the person may not be getting adequate drug for the type of epilepsy. So improper medication, that can be another cause. Third is what we call as a structural epilepsy, in which if in cases of focal seizures, as I told you, so in patients who are getting seizures from both sides of the brain, there is no option of epilepsy surgery because that is coming from both sides. You cannot remove both sides of your brain. So in patients who are having focal epilepsy, where the seizure is coming from one area, as I told you, temporal lobe epilepsy or frontal, there is even a small, maybe 1 centimeter area or a small 0.5 centimeter area, which is an abnormal brain tissue. Now, abnormal brain tissue is a source of seizure. So it is a highly electrical source, and that can cause seizure formation. So in drug refractory epilepsy, we do something called as a video EEG. So video EEG is what we connect the EEG machine will be connected, a wire will be connected, and the patient continuously will be monitored. So the machine will be continuously on day and night, and the machine will be recording the seizure activity. And what we record is the patient's actual seizures. So we will stop the medication, we reduce the medication, and we record the seizures inside the hospital. So the EEG will be connected live, so we'll be recording the seizure live, and we'll be seeing on the EEG where the seizure is coming from. So if the EEG shows that the seizure is coming from only one small area of the brain, then we do something called as a higher resolution MRI. So we tell the radiologist to take the particular sections of that area which we are finding abnormal on EEG. If that area is not what you call eloquent, means if not that area, removal of that area won't cause any issues, or it won't cause any weakness or won't cause any deficit, then, and if that area is abnormal both on MRI, both on EEG, and based so everything matches, then operating those area, then surgically what we can do is we do EEG intra-op. On the brain we put EEG different electrodes, and we record the seizure inside while the surgery is going on, and whatever area is firing abnormal activity, that is removed. So in those patients who are having so if the EEG, MRI clinical match is there, what we call congruence, then that area removal can cause complete seizure freedom. So patients who are on multiple drugs may get completely seizure free in those cases. So every case of refractory epilepsy should be thoroughly evaluated, and video EEG and various investigation your neurologist will tell you. So those should be done, because epilepsy surgery in many patients will give you complete seizure freedom, and it can completely change your life.
Okay. What is a ketogenic diet and how does it help in such a situation?
So ketogenic diet is a modality we use in certain refractory epilepsies who are not surgically amenable. So sometimes, especially in children. So ketogenic diet is when you reduce all the carbohydrates. So it is a diet which is mainly composed of fat and proteins with not much of carbohydrate. So when your carbohydrate is off, your body will produce ketones, and it will utilize ketones as a source of energy for your brain, because brain requires some energy. Now ketogenic diet has been found to significantly reduce the seizure frequency. So when patient with refractory epilepsy, when they are on ketogenic diet, ketogenic diet is a diet particularly prepared. It is not you take anything and you think there will be a ketogenic. It's a separate diet which is prepared for an epilepsy patient. In patients who are having refractory epilepsy, he has to avoid all carbohydrates. There shouldn't be any sugar intake during entire his meal, shouldn't be having any glucose or complex starch, and you induce ketosis. You will monitor his blood for ketones, and you have to maintain that diet for years. And if you take it for a sufficient duration, your seizure frequency significantly comes down. So ketogenic diet is a good modality in patients with refractory epilepsy because it can cause good seizure control.
Are there any new treatments that can give hope to people who have difficult to treat seizures?
So there are two things. One, if patient is not amenable for surgery in refractory epilepsy, the drug resistant epilepsy, the other is something called palliative surgeries. So one is called as a vagal nerve stimulation. So we put a implant in something called as vagal nerve. There is a pacemaker, so it will continuously stimulate that nerve. So that can reduce your seizure frequency by almost 50 to 60%. So there are certain patients who may get even 10 to 50 seizures in a day. In those patients, this can be a good treatment option because it is safe, and there are not much of complication. It's a relatively simple procedure, and it can reduce your seizure frequency. Newer modalities which have been tried are something called as a responsive neurostimulation. It's a machine which is put in your brain and it will detect a seizure and it will give an impulse to stop it. Those are newer things which has been tried, but all those, and there is something called a deep brain stimulation for epilepsy. All those things are only indicated in refractory epilepsy, which are not responsive to, which are not amenable for surgeries. So every day there are new drugs which are being discovered. There are new data being, new scientific discoveries in epilepsy. So every day is a new hope for epilepsy patients.
So epilepsy is surrounded by a lot of myths. So let's bust a few myths. I will read some statements. You tell me if it's true or false, and you can justify it with a statement or two. Okay. Epilepsy is caused by supernatural forces.
That is completely myth. Now with we can show on EEG, we can show that the seizure activity is there. We can even show on imaging there is abnormality. We can show on blood test there is abnormality. So that is complete myth.
False. You should put a spoon or key in a person's mouth during a seizure.
No, that is a myth, because you can injure the patient. Or also you put something that may go inside his windpipe and you may cause choking.
Sure.
So don't put anything in his mouth.
Okay. Epilepsy spreads through touch.
No, there is no epilepsy which goes through touch.
People with epilepsy shouldn't marry or have children.
No, that is completely false. Now, having children, there is no issue with pregnancy. So females with epilepsy can have children like any normal female. So there is no issue at all. And every month I have got one female epilepsy patient, female, who is pregnant. And now some are even having two children also. Today only I had seen a patient who is having a second child. So there is no issue with pregnancy. Your epilepsy won't at all affect your pregnancy at all. So pregnancy outcomes are not affected by seizures if they are well controlled. So it is very important that a female with seizure to be having good control of seizures and to be on a medication which is safe. So there is no issue with marriage as well as reproduction. So it's a complete myth.
MRI or EEG is harmful if repetitive.
No, MRI doesn't require any radiation. So it's a magnetic field which detects the structural changes in your brain. So it is safe. Repeated MRI sometimes we do in certain cases. It is completely safe. And EEG is just EEG. There are nothing, no radiation, no nothing at all, no magnet, nothing. It is a wire which is connected and it is actually mapping your brain. It is detecting the electrical activity in your brain. So even if you do daily EEG, it won't cause any harm.
Smelling onions or rubbing keys stop a seizure?
No, smelling onions or keys won't stop a seizure.
Okay. All people with epilepsy have jerking movements.
And that's what I told you. So there are certain epilepsy called as what we used to call as a complex partial seizures. So certain areas of the brain, they may not generate that seizure, that full jerking. So in focal seizures, like a temporal lobe epilepsy, patient may just stare, or patient may just do what we call a lip smacking. They may just do some chewing movement or something movement, like you may feel the person is eating something. So they may just stare, they may do like this, they may start chewing, they may just they may just move out of the house. So they may just do some activity, they may just touch their clothes. So it is just a transient state that person is not able to know what he is doing. So jerky movement may not be there in all seizures, because certain seizures, focal seizures, may not have jerky movements.
Every time a seizure occurs, there is some level of brain damage.
No. So seizure, unless it's for a very prolonged duration, what we call as a status epilepticus. The status epilepticus is when there are multiple seizures occurring without regaining consciousness in between, or a seizure duration is very prolonged. So what happens is a small seizure won't cause brain damage, because seizure, to cause brain damage, there has to be lack of oxygen. So and there should be brain fatigue. So there has to be a seizure for a very long duration. So a small seizure won't cause any brain damage. Only if it is a very prolonged seizure, 10 to 15 minutes of continuous seizure, and person is not getting oxygen, or if there are multiple seizure occurring without any break, if half an hour there are continuous seizure, every 5 minutes person is getting seizure, that can cause brain injury. A single seizure won't cause any brain injury.
Okay. Every patient needs to undergo MRI.
Every patient need not undergo MRI. As I told you, if it is a generalized epilepsy, if your EEG shows that it is a clear-cut generalized epilepsy, then we don't advise MRI in those patients. If EEG is normal, if the clinical semiology, clinical picture is more in favor of a focal seizure, then definitely MRI is a very important investigation.
Listening to loud music triggers seizures.
Listening to loud music is not exactly a seizure trigger, except in a certain very few seizures, patient may have sensitivity to music. So they call it some musicogenic epilepsy. It's a very rare epilepsy where music can trigger seizures, but it's a very small percentage. Most of the time, it won't cause anything.
Perfumes or strong smells trigger seizures.
Strong smell may not trigger seizure, but certain chemicals in the perfume or they may sometimes be a trigger in certain patients. Most of the perfumes are safe, so there shouldn't be an issue.
Now I will ask some questions which people commonly ask with regards to home, work or day-to-day life. Can people with epilepsy exercise or play sports?
Yeah, all sports. So actually we should encourage more exercise because seizure, there is no relation between exercise and seizures, but there is no issue at all. Healthy lifestyle is actually beneficial for a patient with epilepsy. So there is no restriction at all when it comes to any exercise or sports. They can do anything. So seizure shouldn't stop a person from doing what he like.
Can women with epilepsy safely plan pregnancy?
Yeah, as I told you, woman with epilepsy can lead a normal delivery, normal pregnancy, but you have to have a good seizure control because now there are drugs available which are completely safe. So I have not come across any person who has developed any adverse fetal outcome till now, because we always start patient on, so any female of reproductive age group, we start on medications which will be safe in pregnancy. So it is very important that certain anti-epileptics are absolutely contraindicated in pregnancy. So certain drugs you shouldn't be consuming because that can go to your baby. So those drugs need to be changed. So any female who is planning pregnancy should tell their treating doctor at least 6 months to 1 year in advance, because you will need to change the medication to a safer one, and during that changeover there may be a risk of seizures. So always the seizure medication needs to be changed well in advance. So a female with epilepsy will have a normal outcome. There won't be any issues provided she is on safer medication and she takes the medication throughout pregnancy. They shouldn't stop. Most of the time what happens is, because of the fear that the child will get any problems, people just stop the seizures, stop that medication. So the seizures, multiple seizures during the pregnancy is harmful to the baby and the mother, whereas the medication won't cause any issues to the mother as well as the child. So it is most safe to be on a safe medication and have a normal delivery than not to be on a medication.
Does epilepsy affect memory or concentration in the long term?
So seizures, if you are well controlled, won't cause any memory issues. But if the seizures are uncontrolled, then that can cause secondary changes in your brain. So patients who are having recurrent seizures, that may cause your memory area in the brain, your hippocampus, to shrink sometimes, and your cognition may go down. So memory issues will occur if your seizures are not well controlled.
Can workplace stress or night shifts worsen seizure control?
Yeah, so night shift we don't advise in patients who are having seizures, because as I told you, sleep deprivation is a very common trigger. So night shift should be avoided. And stress is also a trigger. Everybody gets stress, so stress management is important, but that is another trigger. But night shift should be as much as possible avoided, because that can trigger seizures.
Epilepsy can sometimes affect people's confidence, relationships, and opportunities. So let's address the social side. Doctor, how does stigma affect employment, marriage, and confidence?
So there is still nowadays, actually there is improvement in knowledge about epilepsy with the social media, and many nowadays people are more and more gaining knowledge about epilepsy. As you asked me before, there was a myth that there is supernatural this going on causing seizures, and people used to think it is communicable, it is spreading by this, that. Most of the people, now that misconception is going on, people are coming to know about epilepsy. So what happens is, many a time diagnosis of epilepsy can take time for the person to adjust to, because they may feel that they may not be able to do whatever they want in their life. They may feel that their life will be hampered, and they may not have a good quality of life. But now, as I told you, with good anti-epileptic drugs, you may lead a completely normal life. There are many celebrities who are having seizures. They are doing whatever they are doing, everything what is possible. So epilepsy person shouldn't have any issues in getting what they want. So they can do whatever profession they want to choose, except for maybe a driving or pilot. That is the only thing that they will not be allowed. Otherwise, most of the things they can do. They can pursue any sports. There won't be an issue. So most important thing is to have a good seizure control. If you're not getting a good seizure control, then that may cause issues. Marriage, so it is important for a person before getting marriage to communicate with the spouse about a diagnosis of epilepsy, about the medication they are on, and they can convince them, they can tell them that it is safe. If they want, they can involve the doctor, they can talk to the concerned party, may talk to the doctor, they can understand more about the epilepsy. So understanding epilepsy, that it is not communicable, it can be well controlled, it doesn't have any much effect on the fetal outcome, reproduction, is very important. So honest discussion between the stakeholders, that will help reduce the stigma around epilepsy.
How can schools and workplaces be more epilepsy friendly?
So in children who are having seizures, so many times because they are children, they are worried about getting. The parents are also very apprehensive about getting seizures. So in those, we generally advise, we always tell the parent to inform the teachers and the principal, whoever is there, that the child is having epilepsy, and we have to train them. We tell them that in case the child gets seizures, what you should do. Second thing, not to let the seizure, so it shouldn't be that person gets seizure, you don't allow him to come to school for a month. So that there should be good understanding among the staff, that sometimes we see certain they will say don't come to school, and those things sometimes happen. So the people should know that seizure won't cause any issues. They won't be, if it is well controlled, there won't be any issues to the child. Nowadays even we tell them to keep a spray. We tell them to keep one with the teachers also, so that in case a child gets seizures, they can use that spray and the seizure will be terminated. So there shouldn't be panic. There should be good drills. Actually, there should be drills, at mock drills, maybe at schools, which will tell them in case of seizure what first aid to give. So those things should be taught at the school level. And stigma at school level, even the children may be little, there may be lack of confidence, because that may put them at risk of bullying and all those things. The teacher is the most important pillar in that case. So teachers should understand more about seizures, and they should make sure that a child is not losing confidence because of that. So they should behave with the child as they will behave with any other child in the school. So it should be a normal. So there shouldn't be like he's an epileptic, the child has got epilepsy, he should receive any special treatment. It should be a normal child. So everything should be normal. You should give him normal care.
Okay. Let's wrap up this session with some practical and powerful takeaways. Doctor, what are the 3 biggest mistakes people make when handling seizures?
So one thing is that first thing is the first aid. So people everybody panics when somebody gets seizures, they get panic just like that. They don't. So very important is one person, if there are 2 people involved, if there are 2 people around the seizure, one person should stabilize the patient. As I told you, give the first aid. Other person should actually observe the kind of seizures, because whatever the person tells us about seizure, so what type of seizure it is, that thing the doctor will know. So observing the seizure will help us in giving treatment, because the type of seizure is most important when we administer medication. So now even sometimes we tell them to record it on mobile. So we tell the caregiver that one person should stabilize the patient, other person records the seizures, because when we see the type of seizure, it will easily help us in giving treatment. So that is first. Second is people think that the drugs may cause damage to liver, kidney, all those organs, but most of the drugs now are safe, very safe. So there is no issue with any. So most of the modern drugs, they are absolutely safe in case of seizures. And don't stop any drug without telling your doctor. So nowadays what happens, 2 years you don't get any seizure, people directly stop seizures, they stop the medication. So direct stopping of seizure medication can cause a seizure, because suddenly you cannot stop. So when a person who has got adequate seizure control for probably maybe 3 years, then we do a repeat EEG, we do repeat testing, and then we gradually withdraw drugs. So drugs should be withdrawn very gradually. So direct stopping of drugs should be absolutely avoided. Good compliance to drug, healthy lifestyle is very important.
What lifestyle habit helps reduce seizures naturally?
So good sleep will definitely go a long way when it comes to seizures. Good diet, so good antioxidant diet will help. More vegetables, avoidance of alcohol. So addictions, they should be completely avoided. There shouldn't be any alcohol intake, because it can interact with your drugs, and alcohol itself is a trigger. And other drugs of recreational drugs, those are also triggers for epilepsy. So any form of alcohol or any drugs should be avoided. Other thing would be regular exercise. good exercise, yoga, meditation. So those also things have been found to be reducing the risk of getting a seizures. And stress management is another thing. So managing of stress, using less of electronic gadgets. So those things will go a long way when it comes to seizure control.
Your message to people who are newly diagnosed with epilepsy, what should they know?
So first thing I would say that don't worry. Seizure is not something which is going to be disastrous to your life, and it will put your life in disarray. So you meet a proper doctor, you can meet a neurologist, you understand what is your seizure, what is your kind of seizure, understand the type of, discuss very openly with your spouse, you discuss with your doctor, you try to understand what medication the doctor will be starting. They should know that they should be very well compliant to the medication if they want to be seizure free. If they have any problems with the medication, sometimes the person may have less little bit more tolerance may not be very good, so they shouldn't stop directly. So any issue with medication, they should always convey to the doctor so they can change the medication, they can change the dosages. If they wish to get pregnant, they should always tell in advance. So there is no issue with any pregnancy, there is no issue with reproduction, there is no issue with marriage. So a female with epilepsy can have a normal pregnancy, but they should always inform the doctor if they are planning pregnancy so that everything goes smoothly. So epilepsy is not end of your life. There is nothing to be worried about. You can get a very good normal lifestyle if you take appropriate treatment.
Okay. And your message to families and caregivers, how can they help?
So caregivers are very important because they are emotional pillars for the person with epilepsy. Sometimes if you get stressed because of seizure, then the caregiver is the one who you look up to. So if the caregiver itself gets stressed and start taking too much of pressure because of epilepsy, then that may get transferred to the patient. The patient is in an emotional state, so the caregiver has to be strong. They should understand the symptoms of epilepsy, they should understand the first aid from the doctor, they should make sure that the person is compliant to the medication, they should motivate the person to take medication regularly. And other thing is that they should always observe what kind of seizure it is, so they should always follow the doctor's advice. And other thing, in case of drug refractory epilepsy, it is very important for the caregiver to take a video. So video recording of seizure is very important in that case.
Doctor, thank you for simplifying such a tedious topic.
Thank you for giving me the opportunity, because epilepsy is something which is very close to me, and with good treatment we can offer a good quality of life to all patients. Thank you.
To our listeners, if you found this episode helpful, do share it with someone who needs it. I am Abigail George, your host from Team Radiance Diagnostics. We shall see you again with another expert-led conversation. Until then, take care.